Good afternoon, Dr. Smith. I have just conducted a scan on a 4-year-old male infant who is accompanied here today by his mother. I have completed an abdominal ultrasound on the patient and I do want to discuss my findings with you. The GP's clinical question is to determine if there is a presence of a liver pathology or tumour. The child's general practitioner has referred him for an abdominal ultrasound after he was complaining to his mother with abdominal pain for the last month. He has had a decrease in appetite, vomiting, nausea, jaundice of the skin, and his mother has stated that she has noticed some swelling in the abdomen and was concerned. The doctor has conducted blood tests including LFTs and ALPs, which were found to be abnormally high. Other than these recent clinical symptoms, the child was otherwise well and has no other comorbidities present. Upon thoroughly surveying the liver, I found that there is evidence of hepatomegaly with a large 90 by 70 millimeter mass in the right lobe of the liver in segment 8. It is well circumscribed, heterogeneous in ecotexture with an increase in vascularity, not only on the periphery, but also internally in the mass. Liquefaction and septations are present intralesionally with calcifications, causing an acoustic shadow. The lesion is confined to the one section and has not spread to other segments of the liver. In terms of diagnosis, I am querying a hepatoblastoma given the sonographic appearance and the patient's young age, although a hepatocellular carcinoma, a HCC, does need to be ruled out as a differential diagnosis. A HCC is less likely to be present due to the internal liquefaction, the calcifications and the lack of blood vessel involvement. Absence of cirrhosis and also the negative hepatitis serology are also factors as to why I'm leaning more towards an HBL. My recommendation is to perform a CT to determine if there are any lesions near the primary site. In particular, the lungs, to determine if there's any METs. I would also suggest an ultrasound-guided biopsy to give a definitive diagnosis on the mass. Thank you for your time.